Okay, so let's continue our discussion on the class 1C drug. Remember, class 1 pa rin ito ha. So their mechanism of action is still inhibition of the sodium channel. Okay? That is to prevent sodium from entering the cell. So however, their difference from that of the class 1A and class 1B is they don't really have an effect on the action potential. They just block the sodium channel, pero they neither shorten nor prolong the duration, okay, the time of the action potential. So we have here 4 drugs, flecainide and canide, morisizine, and propafenone. However, they are not really very common drugs. So you really have to make a double effort for you to remember these drugs also. So for flecainide, our brand name for this is Tambocor. I just don't know if this is really available in the Philippine market nowadays. I I don't remember seeing this in the pharmacy, but nevertheless, if meron, then that's good. Now, please take note that flecainide, aside from it is a sodium channel blocker, it can also block the potassium channel. Okay? Though it is classified under class 1, so basically yung kanyang major activity is on the sodium channel, but it has an ability also to block the potassium channel. So meron siyang activity na kasama na slow unblocking kinetics, meaning it can block the potassium channel, but it's actually slow in terms of the rate of the blocking. So we have here clinical applications of our flecainide. This is used for supraventricular arrhythmias. Remember, when you say supraventricular, we are referring to the atrium. So remember, we have the chambers of the heart. So if the patient is experiencing atrial arrhythmia, or we call that supraventricular arrhythmia, pero normal when I say normal, the patient has no heart failure, the patient don't have or doesn't have an experience sa myocardial infarction, so walang scarred tissues, walang injured heart, ganon. So normal ang kanyang heart, but merong abnormal firing in the atrium. That's when we use the flecainide. So take note that you don't use this for ischemic conditions. So last time, I think we have defined ischemia. So di ba ischemia class is lack of oxygen supply, like in the heart ha, kasi myocardial ischemia, because of the slowing down of the blood supply. So makukulangan ng oxygen. Okay? So you don't use this also for scarred tissues. So like yung mga may naka-experience ng myocardial infarction. So naka-experience ng heart attack and then naka-survive and then nagkaroon ng arrhythmia, do not use the flecainide. Why? Because flecainide class is pro-arrhythmic. Just like with the other drugs actually. But this one is notorious of like causing arrhythmia also. It's a drug for arrhythmia. However, if you have class A normal heart, matitrigger kasi, magkakaroon ka ng other forms of arrhythmias, especially the most dangerous ones. Okay? Now, we have propafenone also under class 1C. Our brand name here is Rhythmol. Just like the flecainide, we also use this for supraventricular arrhythmias. Okay? Now, what's our problem with propafenone? Adverse drug reactions. It has a metallic taste. You know that, right? When you take yung iron supplements, ferrous sulfate, that's what we describe as the metallic taste. So propafenone has that also, and then constipation and arrhythmia exacerbation. So the patient is being treated with arrhythmia. However, if there is like an overdose of propafenone, this may exacerbate noon yung arrhythmia ng patient. And then we have morisizine, which is an antiarrhythmic drug, which is a phenothiazine derivative. So marami tayong drug class na phenothiazine derivative. We have a lot of like phenothiazine agents classified as antipsychotic drugs. Okay, so pamilya sila kasi they are derived on that structure. But this one now is a phenothiazine derivative, but this is used for arrhythmias, specifically ventricular arrhythmia. So this time, this is on the ventricles. So we have the following drugs. Ano ba yung wala na discuss? The N-kyanide. N-kyanide and the kyanide share the same activity. Okay, you can see that in their names naman. They belong to the same classification, thus they have the same use, and most likely they have the same effect or activity. Most of the drugs that belong to the same class is yung difference nila lies on their pharmacokinetic profile. Okay? Example, yung mga olols natin, marami masyado tayong olols. They have the same mechanism of action, thus they have the same activity in the body. But, mga esmolol, their difference is on their pharmacokinetic profiles. When I say pharmacokinetic profile, I'm talking about like yung absorption, distribution, metabolism, and excretion nila in the body, affecting the duration of action. So some of them are long-acting, some of them are short-acting. So just like esmolol, which is our shortest beta blocker in terms of the half-life. Okay? So yun yung pagkakaiba. If you are asked, bakit masyadong maraming beta blockers, masyadong maraming prills, yung mga ACE inhibitors natin, yun yung pinagkaiba nila. We are attempting to make a new drug with a different pharmacokinetic profile. Okay? So, any question about class 1? So we are done. We are going to move on to class 2. Okay? Wala na? Walang question? I'm really not feeling well. Wala. So class 2 class, these are our beta blockers, or we call them beta adrenoceptor blocking agents. So aside from being an antihypertensive agent and at the same time agent for heart failure, these drugs are also very useful for arrhythmia. So what are the clinical applications of our beta blockers? We use them for supraventricular arrhythmias or our atrial arrhythmias. And that is to prevent also recurrent infarction. So that's our problem, no? Like the patient experiences heart attack and then nakasurvive siya, pwede kasing maulit-ulit yung infarction na yon, and then yung sudden death. That's what we are preventing here. That is why we are going to use the beta blockers. Remember, from the name itself, beta blockers, they will be inhibiting the activity of the beta-1 receptor. So ano ba activity ng beta-1 receptor natin? Uulit-ulitin ko talaga ito hanggang hindi nyo na siya makalimutan. Beta-1 receptors are found in the heart, and if they are being stimulated, syempre they will stimulate the heart also. So, yes, tama yan siya. There will be increase in the heart rate. There will be increase also in the force of contraction and also the conduction velocity, meaning yung pag-conduct ng impulse ng electricity that makes the heart beat, magiging mabilis din yon kapag stimulate natin si beta receptor. So in some cases, that is very useful, okay? Especially for heart failure, for acute heart failure. However, for arrhythmia class, kasi di ba remember, we need to slow down the impulse formation of the heart. We need to slow down, especially for arrhythmia, for tachyarrhythmia, meaning there is a tachycardia, we need to slow down the heart. So that is the reason why we are giving the patient beta blockers. So we are going to block the activity of the beta receptor. Okay, I hope that is clear. And then I have mentioned this also last time when we discussed heart failure and hypertension, that there are beta blockers that are non-selective. The best example for that is propranolol. What do I mean by non-selective? They can block the beta-1 receptors, but they can also block the beta-2 receptors. So remember, beta-2 receptors are found in the bronchioles and in the lungs. And kapag ma-stimulate, nakakaisip ko, pag ma-stimulate ang beta-2 receptor, they can cause bronchodilation. Now, if we are going to block that, remember what's the reverse of the bronchodilation? It's bronchoconstriction. So, kaya pwedeng the patient will have difficulty in breathing, and especially for asthmatic and COPD patient, maaaring hindi talaga dapat natin ibigay yung some of our beta blockers. Again, especially the non-selective ones. And then AV blockade, that's atrioventricular blockade. Just remember, we are going to slow down even the conductance velocity of the heart. And for some, since we are slowing down the heart mismo, this may cause acute heart failure. So these are examples of the beta blockers that are used for arrhythmia. Propranolol yan, ano na lang, edit. It's propranolol. Innovator drug is in the run. Okay? And then we have esmolol, you know this, right? This is our beta blockers. This beta blocker that has the shortest half-life. Okay? So aside from using this for like hypertension, heart failure, and even arrhythmia, we also use this as our drug of choice for caffeine poisoning. Okay? So again, pwede din siyang sa arrhythmia. But please take note, since this is a very short half-life, the half-life is, I guess, less than 10 minutes, we administer this intravenously. So unlike other beta blockers na pwedeng i-take orally. Okay? And then we have sotalol, which is also considered a non-selective beta blocker. But pakidagdag na lang itong activity niya, that though it affects the beta receptor, it has the ability to prolong the action potential. So, ipoprolong yung duration ng action potential natin. Remember the waves there, yung pagtaas, pag sudden drop, and then the plateau. Mapoprolong yung time nun, yung pagkabuo ng impulse. Okay? So, let's not really dig deeper into the beta blocker since we are done with that ulit-ulit na siya na drug. Let's move on to the class 3. Class 3 drugs. Okay, so si class 3 drugs naman, they prolong the effective refractory period by prolonging the action potential. Okay, so just like the class 1A drugs, they also prolong the time for the action potential to happen. Okay? So most likely they will slow down the impulse of the heart, including the formation as well as yung refractory period, meaning yung pag-travel niya Okay, from the SA node to the AV node to the bundles and the Purkinje fibers. That's what you mean by prolonging the refractory period. However, they are not they're classified into another group, no, kasi they have different mechanism of action. These drugs are blockers of the potassium channel. So what they are inhibiting here is both the entrance and the exit of our potassium from the cell. Okay? So what are these drugs? We have here the amiodarone. Have you seen amiodarone in the market? Kasi I think this one is a common drug, the amiodarone. Aside from that, by the way, class, sotalol is also included here, ha. It's a beta blocker, okay? We classify it here in the beta blocker, but since it has an additional activity of prolonging the action potential, kasali din siya dito sa class 3 kasi it has the ability to block the potassium channel. And then we have the beryllium, dophytalide, and ibutylide. Itong beryllium na mention ko na ito sa inyo, this is one of the drug that inhibits the release of the norepinephrine from the adrenergic neuron. You're going to review your notes about that. You can see na meron doong beryllium. Okay, so let us discuss them one by one. Our class 3 anti-arrhythmic agents starting with amiodarone. Ang brand name nitong amiodarone is Fordarone. If I'm not mistaken, isa ito sa mga heart-shaped drug in the market. Okay, if I'm not mistaken ha, heart-shaped ito, yung kanyang tablet. Don't know if you have encountered this one. So, syempre, naka-heart shape na yung tablet niya. Definitely, it is used for the heart condition, especially the arrhythmia. However, amiodarone can be given both by mouth or intravenously. Now, what's the clinical application of our Cordarone or clinical indication sa natin siya ginagamit? We can use Cordarone for both atrial and ventricular arrhythmia. Okay, ventricular and supraventricular arrhythmias, even the serious ones. So kaya this one is very useful in the market. So again, very useful siya na both atrial and ventricular arrhythmias. Supraventricular means atrial arrhythmias yan. However, yung listahan kasi natin sa toxicity nito, mahaba din. So we have to be careful also on using this drug. So it can cause bradycardia. Remember, it blocks the potassium channel, so definitely it will prolong the refractory period, the action potential. That means the heart will slow down. So that is the reason why you have there a bradycardia in the list of toxicity. Bali, it will just become an extension of its activity. And it can cause heart block in diseased heart. So most likely, do not use this if the patient has problems with the heart, just like heart failure or meron siyang post-myocardial infarction. So naka-experience siya ng heart attack and nagkaroon ng scarring in his or her tissues. Now, this can cause vasodilation also in the periphery. So it might also drop the blood pressure. And then it can also cause pulmonary and hepatic toxicity. So prolonged use of this drug or even during overdose can damage and injure our liver and also our lungs. And then take note of this, hyper and hypothyroidism. Pwede siyang hyper, pwede siyang hypo. I'll discuss that later, bakit. Okay? But moving on with the list of the toxicities, this can also cause photodermatitis. Okay? The patient may experience dermatitis if exposed to sunlight. So the drug is the cause of the sensitivity to the UV ray or to the sunlight. Okay? And gray blue discoloration in exposed area of the skin kasi there is one component of amiodarone that causes all of this. Even the asymptomatic corneal microdeposits. There are drug substances that will be deposited in the cornea. Though it's asymptomatic, but nevertheless, meron pa rin deposit. Okay? Actually, in the name, you can actually identify what is in the drug that causes those toxicity. Sa tingin nyo, meron sa name niya that causes the toxicity. Sa name pa lang ha, makikita nyo na yon. Ano kaya yon? Wala, no idea. How about hypo and hyperthyroidism? What's our problem with hypo and hyper? Anong problema dyan? Iodine. Okay, very good. So, iodine. What's in the name? You have here iodine. So, do not forget this. Okay. So, in the name, again, in the name, there is iodine there. So, what is in the drug is iodine. Okay? Yes, hyperthyroidism. The patient has too much thyroid hormones. So, kaya nga hyper. And hypo is the other way around. But everything revolves around iodine. Okay, kasi yan yung ating substance, yung ion natin that is kailangan para mabuo yung thyroid hormone natin. So that is the reason why the patient may experience either hypo or hyper. So ganito kasi yun. Sa thyroid gland natin, that's the small gland na nasa may neck part natin. Again, ito yung ating gland na nasa neck part natin. And nagre-release yan siya ng maraming substances, especially hormones. And these hormones are involved in metabolism. Most of the time, it's on the, yung kanyang major function talaga ng hormone is metabolism. Metabolism of carbohydrates, metabolism of fats, and in the body. Yun yung activity ng thyroid hormones natin. Now, we have two types of thyroid hormones, the T4 and the T3. May pangalan yan sila. T4 is thyroxine, T3 is triiodothyronine. Now, please take note kasi board exam question ito. T3 is the active form of the hormone, while T4 is actually inactive. But inside the body, T4 will be converted into T3. Okay? So, kaya lang, when you give the patient amiodarone, because of the supply of the iodine in the body, kasi kasama siya doon sa drug, it has the tendency to inhibit conversion of the T4 to T3. T4 to T3. May inhibit yung conversion kasi magiging like positive feedback yun siya sa brain na, oh, the body has a lot of iodine supply kasi nga doon siya galing sa drug. So ngayon, yung brain magsisignal yan dito not to convert that T4 to T3 anymore. So the patient now may experience hypothyroidism. Again, the patient may experience hypothyroidism kasi the hormones are not activated anymore. However, the patient may also be at risk of having hyperthyroidism because again, due to the presence of that large amount of inorganic iodine from the outside source, syempre, from the amiodarone. So, if balikan natin yung toxicities ng ating amiodarone, pwedeng hyper, pwede ding hypo. Okay? So, yun yung problema with the too much supply ng iodine. Actually, this is the reason why our salts nowadays class are being iodized. So, di ba tinatawag natin iodized salt? Okay? Kasi dinagdagan ng iodine. That is actually a move of the government to prevent Filipinos from having problems with our thyroid glands. Okay? Pero hindi lahat ng salt natin, syempre, di ba, iodized. Meron naman tayong rock salt pa. And yung ano lang siya, yung talagang pure sodium chloride lang talaga siya. Pero if you want to have more supply of iodine in the body, you use the iodized salt. Okay? Questions? Di ba, pag the patient is experiencing hypothyroidism, ayun yung sinusupply sa kanya, iodine. Anong pinapakain? Most of the time, pinapakain ng mga like shells, di ba? Ganon yung pinapakain talaga sa mga may hypothyroidism. Kasi yung mga shells natin, ano mga shells ko sa dagat? Ito tawagan sa ilahan. Not really familiar with their names. Tahong lang din ako na ilahan. O kanang mga imbaw. Pero the rest, wala na ko kaila sa ilahan. Basta shells. They are actually rich in iodine. Kaya yan din yung pinapakain sa people with hypothyroidism. Kaya lang problem sa people with hypothyroidism, lumalaki yung thyroid nila, no? That is actually the same mechanism with that of the heart failure when the heart class experiences cardiomegaly. Diba? Sa heart failure, kulang ng oxygen. So, nagpe-fail yung heart sa kanyang trabaho. So, ang ginagawa ng body is, mag-a-attempt siya na isolve yung kulang. And that is through making the heart bigger than the usual size. Thinking that larger muscles means mas malakas siya mag-pump. Okay, yan yung mechanism ng body talaga. So that is also true for the thyroid. Kaya yan siya lumalaki kasi the body is like attempting to solve what is lacking. So, yun kasi talaga yung parang program sa brain natin or sa body natin na kung merong problem, merong kulang, the first thing na ginagawa is pinapalaki ang organ. Okay? Kasi nga, pag malaki, parang mas malakas o kaya mas makakasupply siya ng what is lacking nga in the body. Okay, questions so far before tayo mag-move on with the drondarone. Drondarone is just a family of the amiodarone. It's not actually listed here for our class 3 amiodarone, sotalol, brichylium, dopitilide, and butylide. But please take note that this is actually a family of amiodarone. It's actually a structural analog of amiodarone. But what is their difference? The structure is derived from amiodarone, but anong kinuha? Inalis si iodine. Kasi yung toxicity list ng amiodarone, most of this class are caused by iodine. So, inalis nila. Okay? And this one is also very effective. Amiodarone is very effective, especially for serious arrhythmia. So, ito, this is the first anti-arrhythmic agent to reduce mortality rate or even hospitalization of patients with atrial fibrillation. Okay, so that's how effective rondarone is, minus some of the toxicities of the amiodarone. And then we have an investigational drug here. The name is vernaculan. Again, the name is vernaculan class. This is an investigational drug. How when you say investigational drug, this is still under clinical trials. But they have seen the mechanism of action of vernaculan. It's multi-channel blocker. So what do you mean by that? It can block the sodium channel, it can block the potassium channels, or other channels like the calcium channels. Okay, this is being developed for the treatment of atrial fibrillation. However, even if this one is like being investigated pa, they have also determined the toxicity of the vernaculan. So, nagpo-cause din siya ng dysgeusia, that is disturbance sa taste. Wait lang. Nagkakaroon plus ng problem sa pag parang hindi na ata ma-determine if like that the food is sweet or not, ganon. Then there will be sneezing, paresthesia. Paresthesia is tingling sensation sa periphery, and then cough and hypotension. So that is again because of the multi-channel blockade activity of the drug. And then sotalol, remember, is a beta blocker. However, it has an additional use or additional activity, of blocking also the potassium channel. So it can prolong also the action potential. And then we have here the dofetilide or the ticosine, which is ginagamit natin as a maintenance drug for patients with normal sinus rhythm pero may atrial fibrillation. Okay? When you say normal sinus rhythm, yung sinoatrial node niya, yung pacemaker niya, normal naman. Normal yung pag-produce ng impulse, normal yung refractory period, pero the patient may experience atrial fibrillation because of the other cells that have the ability to produce mag-produce din sila ng impulses. However, our problem with dofetilide is this can also cause arrhythmia in the form of torsades de poix, na one of the most dangerous form of arrhythmia. Kapamilya niya itong si ibutilide. Brand name nito is Forward. Okay? And binibigay ito intravenously. That's their difference with dofetilide. Dofetilide is maintenance, meaning this is given orally. Itong ibutilide, ginabigay siya intravenously for atrial flutter and atrial fibrillation, and yung merong normal sinus rhythm. May problema lang talaga sa atria na part ng heart. Okay? But just like the dofetilide, this is also pro-arrhythmic in the form of torsades de poix, or it can cause QT interval prolongation. So remember the tallest na wave in the ECG, that's the QRS, or we call that QT. Kapag kasali itong dito na part after niya, there will be prolongation on that part. So definitely that is still not normal. Arrhythmia pa rin yan. Okay? And then we have the last classification, the class 4, and these are our calcium channel blockers. Now please take note, diba, we have two types of calcium channel blockers, the dihydropyridines and the non-dihydropyridines. Yung dihydropyridines, yun yung nag-end sa dipin. And take note that they block calcium channel located in the blood vessels. So we mostly use them for hypertension and even heart failure, pwede din. Kaya lang itong non-dihydropyridines, they are the ones na hindi nag-end sa dipins. Selective sila on the blockade of the calcium channels found in the heart. So ito yung mas useful pagdating sa arrhythmia. We have two, verapamil and diltiazem. So among the two, verapamil yung prototype drug natin. Ito yung pinakauna. Okay? First introduced as anti-anginal agent, but this time we also use this for arrhythmia and for other heart conditions. So again, dihydropyridines class do not share anti-arrhythmic efficacy because their activity is on the blood vessel. However, they can precipitate arrhythmia. So do not use this. Do not use this for people with arrhythmia na kasi hindi siya effective. And then, isa sa mga toxic activity ng mga dipins natin, yung arrhythmia. Mag-cause din sila ng arrhythmia. Okay? Questions? Wala? You can always ask questions. You can send your questions on the chat box. Para let's try to answer that. Now we have verapamil class. Our brand name is Isopin. Again, they block both activated and even inactivated na L-type calcium channel in the heart. So if we block the calcium, calcium is very needed, not just for action potential, but also for the contraction of the heart class. Kasi remember, our heart is a muscle. So kaya nakasali dyan yung decreased cardiac contractility. Aside from it slows down the automaticity of our pacemaker, the sinoatrial node, and then the conduction velocity of the atrioventricular node. Kasali dyan again sa ang pag-decrease ng cardiac contractility and pwede din makareduce na blood pressure. So, saan ginagamit yung ating verapamil? For atrial tachycardia. That's supraventricular tachycardia. And then the other one is diltiazem. Our brand name, though we have a lot of brands in the market, ha? Pero yung nilalagay dito sa slide ko, either they are the innovator drug, meaning they are the first ones. First one talaga na nag-produce ng certain drug na yan, or that's the most common brand. Yan lang yung two reasons ng brand na nalagay sa aking slide. Okay? So, diltiazem or carbizem. So, they have similar efficacy with that of our verapamil in the management of supraventricular arrhythmias. So, again, it has the same rate of control sa atrial fibrillation. Again, do not forget fibrillation means irregular heart rate. Okay? Okay lang. Why? Ano dito? CCD po. Nag-wild. Inhibits sa reabsorption. Sa NE, I have not read about that, but let's see. Okay, let's check. Yan siya na box. So, reabsorption, no? Saan naman yung hitabo sa world ng sabangan? Wala siya. Wala sa mnemonics pero kasali yung phenytoin sa class 1B. Sa mnemonics lang siya wala. Wala. It has nothing to do with the release. Wait lang. Wala ko kabasaan ng CCB scan. Ay, why? Wala talaga siya. Okay. So again, CCBs don't really inhibit reabsorption of norepinephrine in the presynapse. I think what you are trying to determine here is yung TCA, not the CCBs. The TCA's class can inhibit reabsorption of norepinephrine in the presynapse. When I say TCA, that's tricyclic antidepressants. Yun yung nag-i-inhibit ng reabsorption ng norepinephrine. Okay, so I hope class you're going to use this one for you to easily remember our antiarrhythmic drugs. So there are drugs na we discussed in each classification na hindi nasali dito. Kaya kagaya nung sinabi ni Patricia na si phenytoin, hindi siya nakasali kasi dito sa sa ating mnemonics. But phenytoin belongs to class 1B. Sabihin mo ba mo cellphone? Okay? Okay. Now, wala pa tayong human kasi we have miscellaneous anti-arrhythmic agents. Miscellaneous lang ha. Anti-arrhythmic agents. So, they don't really belong to either class 1, class 2, or class 3, or even 4. They have different mechanism of action. Wala silang yung sa sodium channel, ganon. So, ano ito? Digoxin class is 1. Remember, digoxin is our drug for heart failure. Yung mechanism of action dito, hindi siya nagbago. Mag-inhibit pa rin siya ng sodium-potassium ATPase. The difference here lies on the dose. Okay? Kasi at higher dose, from 1 to 2 nanogram per ml, that's when digoxin class treats arrhythmia, especially atrial fibrillation or flutter. Pero yung lower dose niya, yung ginagamitan natin ngayon sa market, 0.5 to 0.8 nanograms per ml, yun yung dose na ginagamit natin for heart failure. Okay? That is just to inhibit the sodium-potassium ATPase para dumami yung calcium inside the cell. Pag damihan pa natin ang dose, that's the time yung fibrillation or yung arrhythmia ang mako-correct. Now, another miscellaneous drug for arrhythmia is our adenosine. So, we have here adenocard, which is a nucleoside that occurs naturally in our body. So actually, it's a precursor of like making ATP, di ba? Adenosine monophosphate, adenosine triphosphate. And andyan yan siya sa body. Or ADP, ganon. Pero meron siyang anti-arrhythmic activity. But if we are going to take adenosine from the outside source, like ginawa siyang drug, pwede siyang gamitin as an anti-arrhythmic agent. However, our problem with this, it has a very short half-life. It's actually shorter, as in way beyond than the esmolol. Esmolol is less than 10 minutes. Ito, adenosine less than 10 seconds. So definitely, we're going to give this as continuous intravenous na injection. Okay? So parang IV fluid siya na continuous na ibibigay. So ano yung activity ni adenosine as drug for arrhythmia? This is an activation inward rectifier of the potassium current. So definitely, it will aid potassium to enter the cell, but it will inhibit calcium current. Okay, so mag-activate siya ng potassium, mag-inhibit siya ng calcium. So mahirap natin siyang i-classify doon sa mga classes natin. So remember, these two ions are involved in the action potential, okay, sa ating impulse. Kapag yung activity ng drug is on this one, most likely we can classify them as an antiarrhythmic agent. And please take note, currently, this is our drug of choice. Basta mga drug of choice gani, mga board exam questions, gina sila. Okay? Again, currently, this is the drug of choice for our paroxysmal supraventricular tachycardia. Kasi yung mga na-mention natin kanina, or even last time, mga drugs sila for supraventricular tachycardia. But this time, this is our drug of choice. What's our problem with adenosine? It can cause flushing, feeling of warmth due to vasodilation. And then chest tightness and dizziness. And then take note of this, magnesium is another one that is used as anti-arrhythmic agent. However, the mechanism of action is actually poorly understood. But they have seen that magnesium can interact with the following channels. It can interact with the sodium-potassium ATPase, definitely affecting the exchange of sodium and potassium. And aside from that, magnesium has interactions with potassium and calcium channels. But nevertheless, hindi pa talaga masyadong ma-explain ang kabuuan na activity ng ating magnesium. But pwede siya mag-treat ng arrhythmia. Actually, pag sa market class, makakita kayo ng magnesium supplement. May nakalagay talaga yan siya na like good for the heart. Okay, wag lang kayong pasobra. You can have your magnesium supplement para sa maayos na pagtrabaho ng heart ninyo. Again, wag lang pasobra. So where do we use our magnesium? If the patient experiences torsades de poix, may S yan siya ha. Remember, this is one of the most dangerous types of arrhythmia and digitalis-induced arrhythmias also. Pwede natin gamitin si magnesium. These two are very serious types of arrhythmias. And magnesium is effective sa kanila. What's our problem with magnesium? Muscle weakness in overdose. Yun talaga yung target ng magnesium. Kasi si magnesium and si calcium plus magkalaban yan inside the body. Remember, si calcium is needed for muscular contraction. Na pag dinamihan mo yung magnesium mo, bababa kasi yung activity ni calcium. Kaya yung target talaga kapag nagkaroon ka ng overdose ni magnesium, yung unang maapektuhan yung ating muscles. Yes, merong magnesium supplement na pure magnesium. Meron. I have one here sa bahay. I actually take this one. Ito lang yung kasi 'di ba I don't really take like vitamins and other supplements. Ito lang talaga yung supplement na tinitake ko. I think 1 month na ako nag-take nito. I've seen this one sa SNR. Actually, I was curious that time when I saw this ano sa ba kanina itong Davao. Natawag Davao na ito kung SNR. Ay, dili siya mahal. Naging mahal lang siya. Kaya remember, SNR buktuhan ang pagbaligya dito. Pero mahulog lang ata siya og 8 pesos ang isa. So, nag-try kong palit. Puro lang in combination sa Rodron. What was that? I think that was Kirkland. Ang magnesium supplement na ko. Actually, dyan na siya, mahirap siya hanapin sa market. Yung magnesium supplement na hindi in combination. Yung magnesium lang talaga. Yung kasama ng mother ko sa work na may heart condition, magnesium din ang pinapainom sa kanya ng kanyang doctor. And yan yung kanyang problem kasi we don't have the magnesium na pure magnesium only sa Philippines. So, meron man siyang family member na residing in America. So, yan yung nagpapadala sa kanya. Pinapadalahan siya ng magnesium dito para may mainom siya para sa kanyang heart condition. Wala talaga siya dito sa atin, sa mga local pharmacy. Okay? Any other concern or question? Aside from magnesium class, potassium syempre is also used as a drug for arrhythmia. Syempre pag marami kang potassium supply in the body. Mag-increase yung permeability of potassium sa cell membrane, makakapasok siya sa cells, especially sa heart. Okay, mag-increase yung potassium current. Ano mangyayari pag you have potassium? You will have a resting potential, depolarizing action, and yung membrane natin sa cell will be stabilized. Kasi remember, there is action potential because of the exchange of these ions, like sodium will go out, potassium will go in, and the other way around. So yung membrane natin yung magre-regulate ng kanilang activity ng pag-move ng mga ions natin. So, yan yung gagawin ng potassium in the serum. There will be resting potential, depolarizing action, and at the same time, stabilizing our membrane potential. So, since this is potassium class, sodium kasi yung sodium yung nag-start talaga ng action potential, no? Si potassium, though positively charged siya, pero hindi kasi, di ba, remember gaano makaka-increase talaga ng action potential. So, it can slow down the ectopic pacemakers and pwede din siyang mag-slow down ng conduction velocity sa heart. So, ginagamit din natin ito for digitalis-induced arrhythmias and arrhythmias associated with hypokalemia. So, if a person experiences hypokalemia class, hindi lang siya maka-experience ng muscle weakness, pwedeng maapektuhan ang heart. So, kaya hindi din basta-basta na mag-electrolyte imbalance, especially potassium. Maapektuhan talaga ang heart natin. What's the more problem kung masobrahan din ng potassium? Actually, mag-cause din siya syempre ng arrhythmia. Reentrant arrhythmias, yung magpabalik-balik na lang yung kanya impulse. Hindi siya totally ma-distribute sa lahat ng fibers or bundles in our heart. That can cause fibrillation, abnormal heart rate, and take note, arrest in overdose. So, wala na. Magpataka na lang ang imuhang heart until mag-arrest siya because of too much potassium. Di ba you know this, na sa ato ang lethal injection, wala namang good tayo, karon death penalty. So, kung may death penalty tayo, tapos lethal injection yung gagawin sa death penalty, ang ginagamit nila is potassium. They will just give overdose of potassium sa person, and because of that, mag-arrest iyahang heart. That's lethal injection. So be careful also with the administration of this ions. Actually, that's the last part. So, natapos ko talaga siya. Do you have questions? Mag-quiz yun tag angina unya. Kaya nakuman ko. Or concerns or clarifications about our anti-arrhythmic agents?